The interview that you are going to conduct with your client is going to follow a sequence. We call this as the phases of the interview. The phases of the interview provide a structured and sequential approach that helps the nurse prepare, communicate effectively, and conclude the interaction in a professional and therapeutic manner. The pre-introductory phase involves preparation before meeting the client to ensure an organized and purposeful interview. The introductory phase focuses on establishing rapport, clarifying rules, and creating a safe environment for communication. The working phase is the core of the interview, where most subjective data are collected and explored. The summary and closing phase ensures accuracy of information, which addresses remaining concerns and prepares the client for next steps. The pre-introductory phase prepares you for a focused and efficient interview before your actual interaction with the client. In this phase, you review the client's medical record before the interview. Reviewing the medical record allows you to become familiar with your client's background prior to meeting them. For example, knowing your client's diagnosis, if already available, helps you anticipate relevant questions. During this phase, you also examine previous assessments and documented findings. Examining prior assessments help you understand what data have already been collected and what issues have been identified. These may include previous vital signs or nursing notes indicating ongoing concerns. You also identify areas that may need clarification or further exploration. Reviewing your client's record helps you identify unclear or incomplete information that requires follow up. For instance, vague documentation about pain requires further questioning. During this phase, you also prepare an organized approach based on existing information. Using the available data allows you to plan questions logically and avoid repetition. This preparation supports a smooth and professional interview flow. Reviewing the medical record provides essential background information that will guide you in the conduct of the interview. Reviewing your client's medical record before meeting him or her ensures that the nurse, in this case you, will be informed about the client's condition in advance. This is important because you might need specific information about your client before meeting him or her. As you review medical record of your client, you note past diagnosis, treatments, and previous notes. Past diagnosis and treatments reveal ongoing or resolved conditions that may influence current health. For example, a history of asthma may relate to current breathing complaints. You also identify relevant background information that may guide the interview. Key details such as allergies or previous hospitalizations help you focus on relevant areas during questioning. As you prepare for the interview, you also review previous assessments. Doing so helps identify trends and unresolved concerns. Examine prior nursing assessments and documented findings. The past nursing notes provide you insights into changes or patterns in your client's condition. This will also allow you to determine trends, changes, or unresolved issues. Doing so, like identifying trends such as persistent pain or increasing blood pressure, helps guide follow up questions. Prepare follow up questions based on earlier data. Unresolved findings guide you in formulating specific follow up questions during the interview. Identifying areas for further exploration ensures that important issues are addressed during the interview. You identify potential areas that need clarification or deeper assessment. The nurses notes issues that require more detailed questioning. You take note of this, such as unclear symptom descriptions. You also anticipate topics requiring sensitive or therapeutic communication. Sensitive topics like mental health or substance use require careful and respectful communication. Plan a focused and organized approach for the interview. Planning helps ensure that priority topics are discussed without unnecessary deviation. The introductory phase establishes the foundation for a therapeutic nurse client interaction. During the introductory phase, you introduce yourself and your role to the client. Providing your name and role helps the client understand who is providing care, and this will allow your client to build his or her trust towards you. Explain the purpose of the interview. Explaining why the interview is being conducted helps the client understand the importance of participation. Discuss confidentiality and its limit. Clarifying confidentiality reassures the client while explaining necessary limits, such as information sharing within the healthcare team. Establish rapport through a respectful, professional manner. A calm and respectful approach helps create a supportive atmosphere for communication. Ensure clients' comfort and privacy before starting the interview. Comfort and privacy support open communication, such as closing curtains or choosing a quiet area. Introduce yourself and your role. This clearly sets a professional tone for the interview. Greet a client and provide your name and position. This establishes identity and professionalism at the start of interaction. Clearly explain your role in their care. Explaining your responsibilities help the client understand your role in assessment and in the provision of nursing care. Use a warm and professional manner. A friendly tone and appropriate body language encourage comfort and trust. Explain the purpose of the interview. Explaining the purpose helps the client understand why the information you are going to ask is being collected. Briefly describe why the interview is being conducted. This clarifies the reason for asking questions, such as getting the health history. Clarify that the goal is to obtain accurate subjective data. Clients are informed that their descriptions are essential to planning for their care. Ensure the client understands the importance of their input. Emphasizing client input encourages honest and detailed responses. Discuss confidentiality. Discussing confidentiality of information, assuring your client that everything he or she will be sharing to you will remain confidential, promotes trust and openness. Inform the client that all information shared will remain confidential. Explain to them who may access their data as part of care. Clarifying access prevents misunderstanding and supports transparency. Assure the client that only the members of the healthcare team in charge of his or her care will have access to his or her data. Promote trust and openness from the start. Understanding confidentiality encourages clients to share sensitive information. Establish rapport. Establishing rapport creates a supportive nurse client relationship. Use a calm, respectful, and friendly approach. A composed demeanor reduces anxiety and encourages communication. Encourage collaboration and mutual respect. This reinforces the idea that care is a shared process. Set the tone for a supportive nurse client relationship. A positive tone supports cooperation throughout the care. Ensure comfort of your client. Ensuring comfort supports effective communication during the interview. Ensure privacy, sitting, lighting, and physical comfort. These will help your client focus on the questions and in answering and providing you with answers and in communicating clearly. Minimize distractions and maintain a therapeutic environment. Reducing noise and interruptions supports concentration. Allow time for your client to relax before beginning the questioning. Giving the client time to settle reduces anxiety. The working phase is where detailed subjective data are gathered. This is the time that you start collecting biographical data. These are basic information or basic identifying information such as age and occupation, which establishes the context of your care. Explore the client's reason for seeking care. Understanding the chief complaint or concern guides the interview focus. Elicit the history of present health concern. You can use the cold spa. This is a systematic exploration which helps clarify the nature of the problem. Use therapeutic communication techniques. These communication techniques support clarity and understanding. Identify health patterns, risk factors, and strengths. This helps recognize behaviors that influence health. It is in the working phase that you collect biographical data. Collecting biographical data establishes the foundation of the health history. Gather basic identifying data such as name, age, gender, and occupation. These will provide essential context for care. Verify accuracy using the client's own statements. Confirming information ensures correctness. Establish the foundation of the nursing health history. Accurate biographical data support subsequent assessment. Explore the reasons for seeking care. Exploring your client's reason for coming over for a checkup or an appointment would help you identify his or her primary concern. Ask the client to describe their chief concern or the reason for seeking care. This centers the assessment on the client's perspective. Use open ended questions to encourage expression. Open ended questions allow detailed explanations. Identify priority issues. This helps determine which concerns need immediate attention. Elicit the history of present health concern. These will provide you with detailed understanding of your client's current health problem. Explore onset, location, duration, characteristics, aggravating or alleviating factors. These elements clarify how the problem developed and how it affected or is affecting your client. Use the code spa mnemonic as appropriate. Using a mnemonic ensures systematic assessment. Clarify the impact on daily activities. Understanding the impact of your client's complaint to his or her daily activities shows how health affects functioning. Use therapeutic communication. Therapeutic communication supports accurate and meaningful data collection. Utilize techniques such as clarification, reflection, and silence, among others. Using therapeutic communication techniques help deepen understanding of your client's concern. Encourage detailed and accurate responses. Clients are guided throughout the interview to provide clear information. Maintain a client centered approach. All throughout the interview and all throughout your interaction with your patient, the focus remains on your client's needs and experiences. Identify health patterns, risk factors, and strength. Identifying your client's patterns and strengths supports holistic assessment. Assess lifestyle, habits, health practices, and coping patterns. These factors influence overall health. Identify risk factors based on history and lifestyle. Risk factors help guide prevention strategies. Recognize client strengths that support wellness. Factors like strong family support and your client's desire to get better could be used to your client's advantage in promoting health. The summary and closing phase brings the interview to an organized conclusion. Provide a summary of key information obtained. Summarizing confirms what was discussed. Validate accuracy with the client. Client confirmation ensures correctness of the data gathered. Identify or clarify remaining questions or concerns. This is to address unresolved issues. Explain the next steps in the assessment or care process so that clients are prepared for what will happen next. Summarize information obtained. Summarizing reinforces understanding and accuracy. Provide a concise summary of key findings from the interview. Key points are reviewed clearly between you and your client. Demonstrate attentive listening and organization. This shows respect and professionalism. And ensure accuracy of the data that you have gathered. Validate understanding. Validating your understanding of the data gathered ensures shared meaning. Confirm with the client that the summary reflects their concerns accurately. Client confirmation prevents error on your end. Invite corrections or clarifications. Clients are encouraged to speak up should they want to correct or clarify information that you have summarized. Promote mutual understanding. Shared understanding strengthens care. Identify and clarify further concerns. Clarifying concerns ensures completeness of the interview. Ask if the client has additional questions or issues to discuss. Address unresolved concerns. Unanswered issues are clarified at this point. Prepare the client for next steps. For continued care, explain the next steps to your client. Explain the upcoming physical assessment or specific procedures. This is so that client will know what to expect. Inform the client what to expect after the interview. This is so to reduce uncertainty. Maintain reassurance and professionalism. A calm approach supports confidence and trust. The phases of the interview provide a structured process that helps you prepare effectively, establish rapport, gather accurate and meaningful subjective data, and conclude the interaction professionally. By following the pre-introductory, introductory, working, and summary and closing phases, the nurse ensures that the interview is organized, client centered, and supportive of safe and comprehensive nursing care.